Welcome, friends, to Broken Narratives. I am your host, Jay Firangi, coming to you from the still city, Hamilton, Ontario. In today's episode, I am going to cover excess mortality, or also known as excess deaths, which is a calculation of how many more deaths occur than are predicted based on demographic factors, including the growth and aging of the country's population. And I will cover excess deaths beginning from the pandemic year 2020, and also excess death that were still high during 2022 and 2023 in many developed countries. You may not have heard about excess death in 2022 and 2023 because mainstream media had not covered those issues, and that makes you wonder why, because as you know that excess deaths were reported daily, weekly, monthly during the pandemic, and those numbers were on your TV screens when you turn on news channels, and they were reporting those numbers every day, that this many people are getting infected and hospitalized, and this many people died from COVID-19. And all those data was constantly in front of your eyes during the pandemic, but excess death during 2022 and 2023 was still higher in many developed countries, and you may not have heard about it. So let's go through that data. And first couple of clips I have are from Dr. John Campbell's YouTube channel, and he's going to present WHO's own data, which reports excess deaths during 2020 and 2021 pandemic years, and how many people died because of COVID-19, with COVID-19 or from COVID-19, it doesn't matter, but how many people died due to COVID-19, and what was the estimated excess mortality we saw during the pandemic years around the world.
Now, I think it's probably good news that the World Health Organization is starting to publish data on the huge excess mortality that we're seeing around the world and is still carrying on well into 2023. They don't give a lot of reasons for it, but it's interesting that they're publishing the data. Let's look at some of the data now before we discuss it further. So here we have estimated excess mortality. Now the data is going from, as we see, January 2020 through to the end of 2021. The grey are the reported COVID deaths, and the redder coloured line is the estimated excess mortality. And of course we can see that even by this official WHO data, that the excess mortality can in no way be accounted for by deaths from SARS coronavirus 2 from COVID. I think that graphic is pretty clear, and encouraging to see this from the World Health Organization, I think. Now here's another graphic they've put out here. 14.9, basically nearly 15 million estimated excess mortality, but the COVID deaths only accounting for, well, say only, but accounting for 5.42 million.
So as you just heard that close to 5.42 million people died from COVID-19 during the pandemic, and but excess mortality was around 15 million. So not everyone who died during that period died from COVID-19, like twice as many people died from other causes. And I have covered during the lockdown episodes that many people had missed diagnosis, cancer diagnosis. Many people missed treatment for their stroke or heart attack or cancer treatments, missed vaccinations, and many more reasons, economic reasons. All those international supply chains being shut down due to COVID-19, and many people in developing countries suffered due to those reasons, and may have died from hunger. I have reported before that WHO and UNICEF, other have reported, World Food Bank, that many people, millions of 140 million, I think was the number, were people were pushed to brink of starvation due to lockdowns. So those were also contributing reasons for excess deaths during the pandemic. And in this next clip, you will get some more details on different parts of the world and how excess deaths from COVID-19 and other causes was seen during the pandemic years.
You give a bit of a breakdown on this. Let's look at that. So this is the Africa situation. So COVID deaths in Africa, as we know, really very low, largely due to the what is it due to? Due to the demographics, younger age ranges, but also due to other infections and possible cross immunity, and underreporting, of course. But nevertheless, is giving a pretty low figure there for COVID deaths in Africa, but excess deaths again much higher. The Americas is a pretty big area. These are World Health Organization big areas, but again, the official COVID deaths in grey, and clearly much higher overall excess deaths. This is a global trend which is persisting. So that's Europe, as we see there. Excess deaths way ahead of COVID deaths. This is Southeast Asia. And again, okay, we're going to see some underreporting, but again, we see great numbers of excess deaths.
Yes, so as you saw, Africa and Southeast Asia, both of them had multiple times more excess death due to other reasons than COVID-19. And this kind of reporting you do not see on mainstream news media that often. And now let's see some reporting on countries. And next couple of clips I have are from GB News in UK, and you will hear Nigel Farage. He's a politician, and he's now a member of parliament in UK, and he was also a news presenter on GB News, and you will hear his interview with Dr. Angus Douglas, who is an oncologist and at St. George University of London, and they are going to discuss excess deaths in UK during 2022, even after the pandemic was over, as far as I can tell back, because many people do not agree when the pandemic ended, and but still, let's see what was going on in UK in 2022.
Excess deaths, they were figures that we focused on very heavily during the pandemic. It would appear we're still suffering from excess deaths of about 1,000 a week for the course of the last year. Now, bear in mind, we do have an ageing population, we do have a rapidly growing population, but these figures are adjusted to deal with that. Well, I'm joined by Angus Dalgleish, Professor of Oncology at St George's University of London.
I've seen the very raw figures, and they are quite worrying, because there's excess deaths of the younger people going on, not just in the older population, but in the people under 40, and the real peaks between 40 and 64, 65. Now, this is something that is highly unusual and highly alarming. It was initially dismissed as due to people not getting statins. Remember, Chris Whitty said this, which I thought was really quite alarming, because you don't get offered statins till you're over 55, 60, so it can't possibly be involved with that group. Now, the one major thing we said was lockdown. The effect of lockdown and everything it did, this would go bang on to excess deaths due to cancer and various other things.
Because of misdiagnosis.
Misdiagnosis, mistreatments, everything. But there's something far worse than this. Now, when you actually look at these figures that we have, they're the same in Europe, in Australia, in other places too.
Yes, similar things are going on in Australia, New Zealand, and in Europe as well, and I will cover those details as well. And this second clip, you will hear why people, like especially mainstream news media, is ignoring, and government is ignoring this excess deaths, and not investigating why still more people are dying, and as we did during the pandemic, spend billions and billions of dollars, stop people from going to work, divided them into essential and non-essential workers, and shut down schools, and we did so many things during the pandemic to save lives and to so that less number of people die, but excess deaths were still higher during 2022 and 2023. And why media was not reporting on it, why it wasn't in front of on the front page of the newspapers in 2022 and 2023, and why government is not responding to this crisis.
One of the things that I flagged up and nobody's taken any real notice of, and it's even more pertinent now, is that others have pointed out this excess death started and correlates with the vaccine program. So it doesn't mean to say it's associated, but why hasn't it been looked at? Why hasn't it been really, really subtly looked at? And it hasn't, because myself and other colleagues have raised this ad nauseum, and we get absolutely nothing but to say it's all expected.
Does your scepticism about this vaccine make you a pariah in academic and medical circles?
Yes, of course it does. It does, because there is a groupthink that thinks and accepted it's very good, it's safe and effective. When I was trained as a clinical scientist to look at the facts and to constantly change my opinion depending on the facts. And this is what's going on. The facts are changing. And at some stage, well, I point out in the big American flu crisis of 1977, when they were dying, the soldiers were dying in their 30s. They rushed out a vaccine program where 42 million people were vaccinated. And then there were reports of Guillain-Barré, which is this assembling paralysis, which is not uncommon with a lot of vaccines. And instead of denying it, they sent people out into the field. And they came back and said, yes, it definitely goes. And do you know what they did? They turned around and they said, well, no one's dying of the flu anymore. Let's get rid of the vaccine. We should have done that, I believe, a couple of years ago.
So governments and international organizations like WHO has been doing this for a long time. And I have a clip of swine flu, 1976 swine flu report from, I think this is from CBS News. I'm not sure. The video is very grainy because it's from long time ago. And let's hear that reporting on 1976 vaccination that in US.
Remember the swine flu scare of 1976? That was the year the U.S. government told us all that swine flu could turn out to be a killer, and Washington decided that every man, woman, and child in the nation should get a shot to prevent a nationwide outbreak, a pandemic. Well, 46 million of us obediently took the shot.
Did anyone ever come to you and say, there's the possibility of neurological damage if you get into a mass immunization program?
No.
No one ever did?
No.
I can't believe that they would say that they did not know that there were neurological illnesses associated with influenza vaccination. That simply is not true. We did know that.
Then he's lying.
I guess you would have to make that assumption.
Then why does this report from your own agency list neurological complications as a possibility? You didn't feel it was necessary to tell the American people that information.
Dr. Sensor's CDC also helped create the advertising to get the public to take the shot.
The vaccines are safe, so roll up your sleeve.
And now Americans are claiming damages from Uncle Sam amounting to $3.5 billion. By far the greatest number of the claims, 2/3 of them, are for neurological damage or even death.
There are serious concerns tonight about how well the CDC controls dangerous germs that
So 1976 swine flu pandemic, so-called swine flu pandemic, was even worse than in terms of propaganda from news media, and the government was worse than COVID-19 in some ways, because there was only one death from so-called swine flu, because that was a soldier, and there were few reported cases, but none of them were confirmed. If you watch that full segment, 15-minute segment, which is on YouTube. You will see many similarities between that 1976 swine flu and COVID-19's same points that were being reported, that it's deadly and everyone should get it. And as you heard, that more than 42 million Americans had lined up to get the swine flu vaccine, and many had injuries from that, and also there were deaths being also claimed from the vaccine. And that was 1976. And I have another example from 2009 H1N1 swine flu, and this is reporting from India TV, and how during that time WHO had also exaggerated the claim of H1N1 deadliness, and how pharmaceutical companies with governments had pushed vaccines on populations.
Moving on, there's growing global anger against the World Health Organization for reportedly making H1N1 pandemic bigger than it really was. A key accusation is that it was pushed to do so by big pharmaceutical companies who wanted to make big money by fueling fear. Here in India too, public health experts say this isn't the first time WHO has pushed for programs, even though they're not needed in the country.
French pharmaceutical expert Dr. Marc Girard believes that the H1N1 pandemic flu was far from being the worst pandemic in recent history. Many like him had warned last summer that the novel flu was not as virulent as the WHO was claiming, and that the swine flu vaccine was developed in a hurry and has serious side effects. Not only are experts pointing fingers at pharmaceutical giants who've been pushing vaccinations and overselling their benefits while understating their toxicity, they're also attacking the WHO with the serious accusation of having misled the world with their recommendations.
Now let's get back to reporting from UK and data from UK. And this next clip is from the Highwire Del Bigtree show. And you will hear Edward Dowd, who was a BlackRock, the biggest pharmaceutical, no, so not pharmaceutical, but asset management company, and he worked there for a long period of time, and he was managing $14 billion growth equity portfolio when he worked there. He also has worked for HSBC and Donaldson, Lufkin, Jarrett, independent. He's also an independent investment advisor. And during the pandemic time, he was analyzing data, financial data, insurance data, and he also started putting out information regarding excess deaths, which they were seeing in insurance payments. And here in this clip, you will hear him give details on excess deaths in children in UK, and how alarming number of children were dying at a higher rate starting from 2021, not in 2020 in UK.
In my book, Cause Unknown, we highlighted a smoking gun, which was the children in the UK, because their excess deaths were going down with lockdowns, because accidental death is the largest cause of death in 1 through 14. And then the vaccines in the UK were introduced around the November timeframe, and their excess deaths, which were negative, started rising. And they went up to about 16% in 2022. And as of June of this year, we've annualized the 2023 numbers. Their excess death is now 23%. So they went down into the lockdowns, and then they started rising with the administration of the vaccine. Now, people could say it's not the vaccine, but whatever health response has occurred in the UK, more children are dying ages 1 through 14 excessively than were before the pandemic and before all the measures they took. And in the UK, we also looked at ages 15 through 44, Gen Z and millennials, and their excess death rate went to a new high. It peaked in 21. It was thankfully coming down in 22, but it's reaccelerated to an excessive 20% more excess mortality for this age group.
So the main point is, if it is not even related to vaccines, that's good. If it is not, but still there are more people dying in like younger age groups as well, not just older age groups. And nobody, like no government is focusing on that or trying to figure it out why this is happening. Now let's see excess deaths in US in 2022, and this is again from Dr. John Campbell's YouTube channel.
This first graphic here is the United States, and of course, as always, I'll give you all the links. So that's the start of 2022 there. Now that's the end of the Delta wave. That's the Omicron wave, which, although it was less deadly, was much more prevalent. But we do see, as the year goes on, we see that here we had about what we would expect. The green line is what we would expect. The red line is a statistical increase. So for the second half of 2020, we see 2022, we see excess deaths. So have a quick look at that there. So the blue line is the actual deaths. The red line would represent a statistical increase, and the green line is what we would expect. So for the second half of 2022, we are seeing excess deaths in the United States. So the United States, the excess deaths for 2022, although it was increasing as it went through 2022, was 242,000 in the United States.
Now let's see some data for some other countries like Australia, Canada, Denmark, and this will be data for 2022 and 2023.
Here's the data for Australia. So we can see excess deaths have been high in Australia throughout 2021, 2022, and now we're running at round about 17%. So excess deaths in Australia, round about 17%. This is just an incredible amount. Where is the outcry about this, you might ask? Moving on in no particular order apart from alphabetical, Canada. Now, we had been hopeful, and it looked like the number of deaths in Canada was lower than average for a period of time, but now that's sort of settled. And Our World in Data is now, based on the human mortality database, seems to be giving figures of about 12% excess deaths in Canada, above what we would expect. This is Denmark. Again, not quite as high in Denmark, but we're still seeing round about 5% over what we would expect in Denmark at the current time, but it has been fairly high, only dipping below average very occasionally, unfortunately. And of course, as you all know only too well now, we would expect the excess mortality to be lower now because the vulnerable people died during the pandemic, but it's not what we are seeing.
And some more details on Ireland, Netherlands, New Zealand, UK and US. And let's see how excess deaths were still higher in these countries during 2022 and 2023.
Ireland, 20% excess mortality at the moment in Ireland from the latest figures from the human mortality database, illustrated by Our World in Data. 20% excess deaths in Ireland. Very, very high. A fifth higher than normal. Netherlands, a bit lower, around about, I'd say about 9% there in the Netherlands. But of course, still higher, and has been so all of 2022 and into 2023. We are seeing excess deaths. This is New Zealand. Again, round about 5% at the moment in New Zealand. Down quite dramatically, but it's not long since it was over 20% in New Zealand. And New Zealand peaking at over 30% excess deaths. This is just a horrendous level of excess deaths in New Zealand, peaking at over 30% excess deaths. Why this isn't the front of the newspapers, I don't know. This is the United Kingdom. Ours are higher than we would like. So the United Kingdom there, we're around about, this latest is about 5%, I would say, there in the United Kingdom. This is the United States, so excess deaths high. Again, this is the human mortality database, all the way through from 2020, and now round about the 9% mark, as it has been throughout 2023 probably dipped down to about 8% there, but these are more than we would expect in the United States.
And now I want to go through some articles and some government websites to give you raw data from some government's reportings on excess death. So this one, first one is from Canada, and this is from Globe and Mail. More people than expected are dying in Canada in 2023 for reasons that are not yet clear. This was published in February 2024. More people than expected are dying in Canada for reasons that are not yet clear. Estimated excess mortality dipped in January and February, but the latest 2023 figures indicate it is about 15% to 20% higher than it was in 2020 and 2021. According to Tara Moriarty, an infectious disease researcher and co-founder of the grassroots group COVID-19 Resources Canada, that's considerably low than in 2022, which was a horrific, really bad year in Canada, but it's still higher than the first few years of the pandemic, she said. Since the start of the pandemic until June, her group estimated there have been nearly 19,500 excess deaths in Canada, which is about double the number of Canadian deaths in the Second World War. The numbers is adjusted to subtract deaths from drug poisoning, suicides, mass homicide, and a heat wave in BC. The total number of COVID-19 deaths that have been recorded since the start of the pandemic, however, stands at 53,216 according to Public Health Agency of Canada data. So total 90,500 excess deaths in Canada, and out of that 53,216 from COVID-19. So as you can see, many more people died due to other reasons. And now let's see government's own data, and this is archived version of the excess data reporting by Canadian government. And here in this graph you can actually see again this blue line on the top is excess deaths, and this is during 2020. And now let's see 2021, same thing, excess deaths still higher. But if the pandemic, after vaccines and everything, after 2 years, natural immunity, excess deaths should be down. But again in 2022 you can see during most of the year excess deaths were still higher. This is 2022, and finally 2023, this is data up to August, end of August, and you can still see that excess deaths were still higher in 2023 in Canada. This is from UK, and UK government reporting on excess deaths, and as you can see, the green that is, you can see above the black dots, those deaths are not due to COVID-19. The blue is deaths involving COVID-19, and green, as it says, deaths not involving COVID-19. And the deaths you see over the black mark in green are not from COVID-19. So still more people were dying in 2022, and not as that many in 2023 in UK. And now let's see, this is for Europe. This is from EuroMOMO data, and they have graphs for different age groups, and as in some age groups there are more people dying compared to others, like 15 to 44 years of age. This graph begins from 2019, and it's well into 2024, the data. And you can see that during 2020, 2021, 2022, excess deaths were still higher in this age group. Again, same thing for age group 45 to 64. Well into 2023, excess deaths were higher. So if the pandemic was over and people were vaccinated and less number of people were dying from COVID-19, why excess deaths were still higher in many countries? Here is data from New Zealand, and just focus on right here deaths, and now let's see just last 4 years. So 2019 34,260, 2020 32,613, so it went down. In 2020 you can say lockdowns worked in New Zealand. And now let's see 2021, again back to 34,932, more deaths compared to 2019. And see these numbers here, 2022 and 2023, 38,574 more people died in 2022, and in 2023 37,884. It's not a total excess death, sorry, these are death numbers. So but more people died during 2022 in 2023 in New Zealand as well. This is data from Australian government measuring Australia's excess mortality during the COVID-19 pandemic until August 2023, and they have mentioned percentage here, excess mortality by year, Australia 2020 to 2023. And as you can see, 2020 was minus 3.1, 2021 1.6, 2022 11.7, and 2023 6.1. Excess deaths were higher again in 2022 and 2023 in Australia. This is the last article or last data point from our World in Data. This is for US, and as you can see, all of these countries have excess deaths higher than predicted during 2022 and 2023. So when you did not hear about this in the news, that makes you wonder why wouldn't they report this data. And this is a concern of many scientists and public health officials, some of them who have reported on this, but they are not given their time, or their they are not given opportunity to present this data, because that would cause panic. I think then people start questioning then why, like, if the pandemic is over, did vaccine work or not, what happened, what's going on, so why they are not reporting, that's a mystery. So this brings me to the end of this episode, and in the next episode I will cover vaccine injuries from COVID-19 vaccines, especially AstraZeneca, Moderna, Pfizer mRNA technology vaccines, and why they were ignored. There are many examples and much more data on that as well that you have not seen in mainstream news media. There were some reporting on individual cases where vaccines was considered a cause for death or a injury, but I will give you those details in the next episode. So again, you can check out all of this data for yourself, and I will provide all the links in the description section. And with that, I would like to thank you for joining in and watching Broken Narratives. I am your host, Jay Firangi, coming to you from the Still City, Hamilton, Ontario, and I will see you in the next episode.